everybody. Thank you so much for joining us today for our expat chat today. I'm so excited and so honored to be talking with my favorite doctor, Dr. Benitez. Many of you saw the video that I posted a few months ago about a recent health scare that I had. And Dr. Benitez is the doctor that I mentioned in the video that came out of the CT room and put his hand on my leg. I remember it. It's probably the thing I remember more than anything in the whole experience. But you said, "Are you in pain?" And I said, "I'm okay." And you said, "I'm here with you and I'm going to stay with you." And I was like, wow, this guy he's amazing. He's awesome.
Thank you.
And you kept your word. You did. You stayed with me through the whole entire process. And I always felt comfortable and confident with you. So I want to thank you so much for that. And I want to talk about a couple of things today. The first thing is, can you just tell us a little bit about yourself and your background and why you chose butts? I don't know.
Well, first of all, thank you very much for this interview. I'm really honored to chat with you. I was born in Guadalajara, but I was raised in Mexico City. I have a really nice childhood, pretty normal. I get a lot of contact with doctors when I was young because my mother couldn't get pregnant again after she delivered me. She has something called endometriosis.
Okay.
So she couldn't get pregnant again. So I remember to go a lot of, I have a lot of visits to a lot of gynecologists. So that's the first time where I thought that I was to become a doctor, a gynecologist in that moment. So I focused and I told my mom, I want to be a doctor. And she said, well, you're too young. Let's see how it goes. But yeah, then I applied to med school. I get in, and then that's when I probably changed my mind to be a surgeon, not a gynecologist. Right. And the first time I want to become a pediatric surgeon.
Okay.
But
that's scary.
Yeah, later on I realized that I probably will not be able to deal with this suffering from kids, from sick children. It's heartbroken for me. So in that time, when I started my internship, I was invited from a group of surgeons who they were colorectal surgeons to work with them. So I get a lot of colorectal surgery stuff in my life, and I realized that that's what I want to become. So I applied to this exam to enter into the residency in Mexico, who is really tough. There are like 30,000 doctors to apply to this test.
Wow.
And just 6,000 get in. Fortunately, I get admitted. I did my general surgery training for years. And then I applied to colorectal surgery to do 2 more years. After that, I go to Brussels, Belgium to do a training in colorectal laparoscopic surgery. And then I come back. I come back to Mexico City. And then happened something that changed my whole life, that I was coming back from work. And when I was taking out from my car, I get a gun in my head. Somebody was stealing my car, but I get a gun in my head, and they hit me with the gun to get stolen my car, and then
really scary.
Yeah,
That's a lot of trauma.
After that, every time that I was in the car, I was like, really shocked, and I that's when I realized that I don't want to live here. I don't want to being scared all the time, and we started thinking where to go. My wife was pregnant, and I get a really good friend that he got married here in Cabo, in La Paz, with a other doctor that is from here. And this hospital was new. And he called me and said, I know you want to leave Mexico City. Here's a new hospital. There's no colorectal surgeon. So I think could be a really option for you. So I come with my wife pregnant to this city. And in the first side, doesn't like too much because we are get used to that the big city.
You
come here to this like
Right. Yeah,
all
I
this.
know.
So it was hard, but I said to my wife, let's try it. So I get admitted to the hospital and getting better day by day until we said that okay, now I think we stay. The first year was really tough, more for my wife because she was
Mm-hmm.
newly
Yeah.
mom with
Yeah.
a new baby with far away from her
Mm-hmm.
family, her
Yeah.
friends. So was
That's tough.
tough, but she was by my side,
She was a trooper.
and yes, and now we are
Oh,
7 years
yeah.
now.
Wow. Your kids have grown up here now.
Yes.
Yeah, you have two beautiful children. I know you have a practice, but you also you also do ER shifts, and that's where I met you.
Yes.
So obviously people want to stay out of the ER, obviously. But what do you think when are working in the ER lands most tourists or expats or people in general? What do you see most patients in the ER for?
I think that the main thing probably the accidents. Okay, there
Mm-hmm.
are a lot of accidents, car accidents,
Uh-huh.
injuries,
Uh-huh.
broken bones.
Mm-hmm.
Probably that could be the main thing that we saw in that. But
Yeah.
stitches, surf injuries, sports
Yes,
injuries,
surf. Yeah.
ATVs accidents.
Yeah.
So that probably will be with the tourists the main thing. Also, food poisoning. There's
Yeah.
a lot of people like you with
Yeah.
food poisoning with acute diarrhea,
Right.
dehydration, and infection diseases. Here also there's all the tropical countries.
Mm-hmm.
They have a lot of infection diseases,
Yeah.
and Mexico is one of them.
When somebody has, like, say, food poisoning, if they're visiting here and they get food poisoning, how do they know that it's time to go to the ER?
That's a really good question. There are like to be like red flags. You know that you have to go to
Yeah,
the
because I
hospital.
didn't listen to those red flags. I waited, and
Yeah,
I waited too long. So,
yeah. For example, a diarrhea that lasts more than 3 days,
okay.
with more than 5 bowel movements in a day.
Okay.
Okay, with all liquid.
Yep. I missed that one.
Yeah,
Okay.
that's moment. Not because the infection or the bacterial hydration,
Mhm.
and you could have other complications in
Mhm.
your kidneys, for example,
Yeah.
to this dehydration. So it's important to first go to the hospital to get IV
Uh-huh.
hydration,
Mhm.
okay, and of course to figure out what is going on, why you got this diarrhea.
Okay.
The, the good thing is that the most of these kind of food poisonings they are from infection that they will go away with that without any antibiotics.
Mhm.
They are just like toxins that you
Mhm.
get and you take out in probably a couple of days, like a flu.
Right.
Okay, but there are other ones that, of course, they will need some antibiotics, like
Right.
strong antibiotics, like
Right.
your case. So that's
And there's no
what.
way I could have known.
No,
Like, I just was sick, so I needed to come here for you to say, "Hey, this is not just food poisoning. You're sick. We have to give you these strong antibiotics." So I like that benchmark of 3 days of diarrhea more than 5 times a day. That's
fever, for example, is
fever, which I
other
had
red
100
flag.
over 104 fever. So fever is a red flag.
Cramps that
Pain.
pain, yeah,
Uh
a lot
huh.
of pain that
Uh
increases
huh.
with time. Not getting better, it's getting worse.
Yeah.
Okay, that's also a red flag, and of course, other even worse like bleeding, for
Yes.
example, okay,
Right.
rectal bleeding or
Mm-hmm. For me, one of the reasons I didn't go to the ER is because I'm used to, like, the US system of medicine where you're so sick and you go to the emergency room and you're sitting in the emergency room for 6, 7, 8, 9 hours. You're sitting there and you're sick. A few years ago, my youngest son was in incredible pain, and we were in the emergency room for almost 7 hours, and he was on the floor of the emergency room, doubled over in pain. And once we finally got back, we found out that his appendix was rupturing and he had to have immediate surgery. But we sat there with him crying, vomiting 7 hours. So when I think about going to the emergency room, I'm just like, I don't even want to deal with it, you know? but the experience is so different here. Like I walked into the emergency room and honestly within 30 minutes I had an IV, I had care, I had attention. And so for I think Americans and also I think Canadians, we aren't used to that. So why do you think that the level of care that doctors provide here is so different than in the US? Like
Okay.
what is the difference?
Well, I think that we need to separate that you right now told me about this 7 hours
Mhm.
waiting. That happens here in Mexico, but it happens in the public hospitals.
Okay,
Probably the difference is that in the private hospitals, you are paying for this care.
gotcha.
Of course, the care of the doctors has to
Mhm.
be the same, but here in Mexico, the public system is really bad. It's
Okay.
really, really bad. The public system could be similar that you suffer in the United States and in Canada. But I think that also you said something really important. It's something that a lot of patients mentioned to
Mhm.
me and to other doctors that this care of the human
Mhm.
is different. And I don't know why. I don't know.
It's so different.
I don't know if it's something, well, I think it's something that I just think is the Mexican
Ah,
or the Latin
culture.
people, the culture that, I don't know, we are more warm with
Yep,
people.
for sure.
We understand a little bit more the suffering of the
Mhm.
patient because there's any like different class in medical school to be more gentle with the patient. No, I don't think so.
Mm-mm.
So probably it's the genetics. I
Yeah.
don't know.
That actually is the first explanation that I've heard that makes sense. I think that actually makes a lot of sense.
Yeah.
So, well, switching gears just a little bit with your human care, I love your sense of humor,
Thank
and
you.
you have so many fun things in your office. And I was sharing with you earlier that my dad had colon cancer,
Yes,
and we were talking about March is colorectal health awareness month.
that's right.
So I love your approach with all of your like poo things. Talk a little bit about why you make it fun.
Well, I think that there are a lot of taboo in
Mhm.
this, of course, human area of the body. There are a lot of
Yeah.
things that we need to broke to
Right.
change the
Yeah.
part. I think that twisting into more fun and more normal, like
Mhm.
go to the ophthalmologist or go to the
Yeah. Or
dermatologist
the
because
dentist or
I try to make it a little bit fun to like broke this tension
Mhm.
about this consultation, and I think it worked. It worked because the patient that enters into this office, they start feeling, okay, I'm feeling more
Yeah.
relaxed now,
Yeah.
and I think also my personality helps because I'm more
You're
relaxed,
more welcoming.
and so also that helps.
You know, my dad didn't really have any symptoms. He was anemic. I just said, Dad, have you had a colonoscopy? And he said, No, never in my life. And he was 70.
Okay.
And so they did a colonoscopy and they found out that he had cancer. Are there symptoms that people should be aware of, or should they not depend on there being bad symptoms, but just go ahead and get a colonoscopy anyway?
The colorectal cancer symptoms, they are really not specific. In the earlier stages, probably you will not have any symptom.
Okay.
That's why we have the first colonoscopy at 45 years.
Okay.
Okay, even
45.
if you don't
Okay.
have any symptoms.
Okay.
In patients, of course, that they had a relative with colorectal cancer is different, like your
Mm-hmm.
case.
Mm-hmm.
But in the like normal population with no colorectal cancer in first degrees families, we need to start at 45. We start seeing in younger people. So
Really?
also that's why they move 5 years earlier. So
Okay.
now it's for every but at 45, and then every 10 years if the of course if the colonoscopy is
Clear.
clear,
Mm-hmm.
the next one could be at 10 years if
Okay.
there's any symptom, of course. If you have red flags, which are losing weight,
Okay.
not related with more exercise or more
Right.
specific diet, changing your bowel habits in your
Okay.
bowel movement, something that is called thin poops,
Okay.
or noodles,
Mm-hmm.
okay, that's also a red flag, and of course blood in your stool. That's the
Okay.
main thing. But sometimes the bleeding could be so little that you will not see in the stool.
Right.
It's inside the stool.
Right.
So it's really important to have, probably before the colonoscopy, a fit test to know if there's blood in the stool, and then the colonoscopy.
Okay.
Probably that will be the main symptoms. But even if you don't have any of those, it's important to have done your first colonoscopy at 40. The polyps are like, well, the colorectal cancer comes from a polyp 90% of the time.
Okay.
Every time we saw polyps in the colonoscopy, we need to remove it, because with our own eyes, it's impossible to know if it's a cancer or it's not. Of course, 90% of the polyps, they are benign, but of course there are other ones that could be cancer, and that's why it's important to remove them and send it to the pathologist to have a real diagnosis. Okay. There are other kind of cancers that they are not related with polyps, but yeah, the 90% they come from polyps. The polyps are like this one, for example.
Okay, so they look like just little bumps.
Yeah, little bumps. They grow really slow. They said that probably they will grow 1 centimeter every 5 years. That's good, because that's why we can diagnose colorectal cancer in early stages.
Okay. Do you do them in your office or in the hospital? What's the procedure for people?
No, it has to be done in the hospital, because we used to do it with sedation, and you need an anesthesiologist.
Right.
Be careful with all your signs, and with of course the oxygen. So, and with no pain. Okay, totally painless. It's not a general anesthesia; it's just a sedation. So you will be sleeping. But if I told you kinda, you will be aware of my voice, but you will not feel nothing.
Okay.
And then you can go home.
Okay.
After we finish, you'll stay in the recovery room probably for a couple hours, and then you can go home. The awful thing of the colonoscopy is not the colonoscopy, it's the day before the colonoscopy. And you know why.
I do know why. Yes, you have to clean your colon. Like, it has to be clean, right?
That's the awful thing. But
yeah, and not eating for the whole day.
Yes, just liquids and
Jello.
Stay really close to your toilet.
Absolutely. Absolutely. Well, thank you so much for chatting with me and my audience today. And if we want to get a hold of your practice, how can we reach you? Like, do you have a website, or how can people reach you if they are ready to get a colonoscopy?
Well, I work here in this hospital, who is the H Plus hospital. So if you want to have a visit with me, you just can call the hospital and make an appointment with me. But I got my Instagram profile, which is the one that I use more.
Okay. Thank you again so much. I'm so happy to be sitting here with you, feeling completely healthy and having such a great experience.
It was my pleasure. It's really nice to see you. I remember another face when I saw you in the hospital, and seeing you right now, happy, really radiant. So that's the best pay for us to see you
thriving.
So thank you very much.
Thank you so much. I appreciate you.
Okay.
Thanks for watching.
Bye.